it has slid back from that point so significantly in the last 15 or 20 years. It's extraordinary. For if you talk to clinicians who've been in the service longer than I have, they don't recognize the system they work within anymore. It's so different. And I started as a junior doctor in Essex, and I've worked in London and Bristol, Gloucester, but mostly in London. I did most of my work in London. And I think working as a psychiatry doctor, particularly, I was working in North London and East London. You're very aware when you're working in psychiatry that a lot of your patients are living already on the fringes of society, and they struggle to access what they need in a lot of ways. And so even when I was working in the service up until 2018, some of our patients required outreach from our teams to enable them to access what they needed, to go out and meet them where they needed, and give them the support they needed. And I think now the knowledge that those patients and so many others are not going to be getting what they need is a terrifying thought. We don't hear from the voices of homeless people, people with severe psychosis, people who have severe and enduring mental illness. I mean, when you read in the papers about what's happening to the NHS, I haven't seen any articles written from their perspective, Yeah, so there's a metaphor in the book about a car going along the road, an old car, and how the passengers in the car are the patients, and the car itself is old and there's things that need to be replaced. And the politicians have been in charge of keeping the car going along the road. They've been in charge really of the budgets to decide whether it's going to have a new engine or new tires or new whatever it is the car itself needs. But they're not the people driving the car. The people driving the car are the staff. And sometimes there's this false assumption from the public that the NHS staff are the ones with the power to change things, and that the people that, if they just worked harder, things would be better. And so sometimes as things are going wrong, the frustration that patients have about the situation is taken out on the staff. But the staff are just driving a rickety old car, and they're trying their best to keep the patient safe and keep it going along the road and not have a crash, But it's the politicians who are the ones who really have the power to to modernize that car, to make sure that it gets to its destination safely, and they're not taking responsibility for that at the moment. Yeah, so it's been very cleverly misrepresented, I'll say that. Privatization is something that's sometimes spoken about, but often as a sort of future threat to the healthcare system. It's not spoken about as a danger right now and something that's encroaching on the healthcare system and that is accelerating. And part of that is because of the definition of privatization. The World Health Organization, and I'm going to get the wording wrong, but it's something like it's the increase in external organizations and private companies taking on the running or the ownership of a public service. There's a misconception that privatization simply means buying a hospital and entirely running it, but that's not the case. There's a situation in the NHS at the moment where in England alone, we have thousands of NHS services now that have been outsourced to external providers, including private companies. And all of that represents privatization because it's the systemic disruption and fragmentation of a system which once was whole and once was run entirely by the public sector. That's not the only example, but it's probably the most significant. The other aspects of privatization that already exist are the private finance initiatives, which were brought in around the turn of the century. First started by John Major's government, but they didn't really progress very far with them. It was more with Brown and Blair. And what happened there was no politician ever wants to make the financial outlay to build new hospitals because it's enormously expensive and would put the country probably in debt. And so they came up with a plan where private companies would pay for the building of hospitals along with other things like roads. And they would own the hospitals and the NHS would lease them back. And what that has resulted in is a situation where we are in debt to many private companies, and the debt is held locally by NHS trusts, many of whom are having to pay such large bills in debt repayment now that in some cases it's double their medicine bill every year.